Well, you know, varicose veins don't just affect women. Many men suffer with the horrible symptoms too, but often don't say anything about it, assuming it's more of a women's disease. That was the case with our next guest, David McCullough, the mayor of Cheatham County. He's joining us now along with vascular surgeon Dr. Stanley Snyder from the Vein Center to tell us more. Welcome to the show.
Welcome.
All right, Dr. Snyder, let's start with you.
Okay.
Often, of course, a lot of people associate varicose veins with women, but today your patient David is here, and he suffered with varicose veins for a long time.
He really did, and not uncommonly. Men have this disease almost as frequently as women, not quite as much. They don't have quite as many hormonal changes. They don't get pregnant. But I would say in our practice, 20–25% of our patients are men. And like many men, David kind of put up with these for 20–30 years before he decided to have something done about it.
Right. Now, David, let's hear from you.
Okay.
You had suffered with this for a long time. Did you have any idea the treatment would improve the quality of your life as much as it did?
It's been amazing. See, I've had varicose veins since about 14. Since it's hereditary, I'm assuming, and so if I bump my leg, I'd have some type of a bruise or a blood clot. It would hurt, be painful, and so and I didn't realize how swollen my legs were.
Right, we just were seeing some pictures of your legs, and it really did. It looks much different today.
Oh, my wife said, your legs look skinny now, so I guess it's just the swelling from those varicose veins.
Right, it often also affected how you feel. How do you feel today?
Yes, like I stand a lot, and especially if I'm doing a speech or talking or in some kind of ceremony, by that evening my legs are so tired and just feel like lead almost. But ever since the procedure, it hasn't felt that way. They feel more energetic. Don't feel like they're tired at all. It's been wonderful. I wish I've had it done sooner.
Yeah, and what's funny is it wasn't long ago, and it looks completely different. You want to show everybody?
Yeah, sure.
Let's take a look at the big difference. So we saw the before pictures, and they look completely different.
Right, about 2 weeks ago we had the phlebectomy, and they're still healing up, but they feel great. The phlebectomy was really a piece of cake, really. I went back to work, really never shut down at all, stayed busy, went to a leadership training program right after the laser treatment, and then after the phlebectomy I had a whole bunch of Christmas events to go to, so just kept going.
Yeah, you definitely don't need those to slow you down.
No.
So it looks great. I'm glad you're feeling better. And Dr. Snyder, tell us how common it is for patients to have multiple treatments.
Well, it depends on multiples. There are two different issues. One are the ablations, and he actually had, I think, both legs. So we do one leg at a time as far as the ablations go. If there's more than one vein that needs to be done on a leg for ablations, maybe the greater and the lesser or a perforator, we do those at the same time. So you might get 2 or 3 veins treated at the same time for an ablation on a leg, but only one leg at a time. The phlebectomy is probably half the time. Once you take the pressure out, what was causing that heaviness and the stension and the swelling was the reflux is the main problem. So once you ablate the vein and get rid of the reflux, most of the symptoms go away. If you haven't put it off for 30 years, most of the time you don't have to have phlebectomies. They'll just go ahead and collapse and wither. But when they're large and huge like his were, well then they're still there. They're still giving some discomfort, so we remove those with those tiny phlebectomy incisions. You can still see his incision areas because it's only been 2 weeks, but 2 or 3 months from now, you won't even be able to see those.
Right. But such a big difference in a really short amount of time.
Oh, yeah.
Dramatic. So how is the Vein Center unique in the treatment options that you offer patients?
Well, I think the fact that we we don't separate them out. Some places might drag this out a little more. We do one leg and then we do the other leg, and then we're done many times. If you have to have phlebectomies, we generally do that in one sitting. I've heard reports of people saying, well, they told me I'm going to have 10 treatments or 8 treatments or something like that. We do, if you need phlebectomies, we do them all at the same time.
All right, great. And Mr. McCullough, what would you tell people who are out there considering treatment themselves who've been suffering with varicose veins? What would you say to them?
I would say go have the procedure. I put it off for a long time because I just thought I'd just live with it. But I would say go and meet with the doctors, and I will say the staff, Dr. Stanley's staff, is phenomenal. I mean, they're just great to work with. I would say go have it done. I wish I'd had it done 30 years ago.
Well, thank you, Mayor. Thank you, Dr. Snyder, for being here. You also have a special offer for folks today. The first 10 callers to 615-269-9007 will receive a complimentary consultation or a second opinion. The Vein Center has 2 locations, one in Belle Meade at 615-269-9007 and another in Cool Springs at 615-503-9895. You can also find more information on their website. There's a link on the More at Midday section of WSM.